Good afternoon, and thanks for joining us today. In the Legislative Building in Regina, we have Premier Scott Moe and Dr. Saqib Shahab. Joining us over the line, we have Marlo Pritchard, President of the Saskatchewan Public Safety Agency, Scott Livingstone, CEO of the Saskatchewan Health Authority, and Dr. Susan Shaw, Chief Medical Officer for the Saskatchewan Health Authority. Both the Premier and Dr. Shahab will have brief opening remarks, and then we'll have time for questions. Premier?
Good afternoon, everyone, and today we are reporting 4 new cases as well as 14 more recoveries. All of the 4 new cases are in the La Loche area, and while it's too soon to tell if this is any kind of a trend, it appears that the efforts of so very many people on the ground in that community and in surrounding communities are making a difference. So once again, I want to take the opportunity to thank all of the community leaders, the volunteers, the healthcare workers, the public safety officers, and everyone else who is working so very hard to control the spread of COVID-19 in this province, but specifically in this province's northwest. And I want to thank everyone in the Loche and the surrounding communities who are doing your part by following the physical distancing guidelines that have been set out. This is still the most important thing that we can all do to protect ourselves, to protect our friends, and ultimately to protect the elders in our community. So thank you. Thank you for your efforts. This is how we will be able to manage the situation not only in the Northwest, but any other localized outbreaks that may occur in the days, the weeks, and ultimately the months ahead. The situation in Lloydminster also continues to improve. As a result, Phase 1 of our reopening plan can start today in Lloydminster, and Phase 2 will begin there on May the 19th, the same date as the rest of the province. Phase 2 will be a very important step across the province as it involves a lot more businesses and services than in Phase 1. And based on the discipline and the good practices Saskatchewan residents have followed to date, we remain confident that we can continue to reopen more of our economy while continuing to control the spread of COVID-19. But we need to remember to keep following the same good physical distancing practices in order to be successful. Finally, today, I just wanted to mention the great work that is being done at an organization right here in Saskatchewan. That's the Vito Intervac Lab at the University of Saskatchewan. There are researchers, they're researchers at those labs and all over the world who are working tirelessly to develop a vaccine and to do so as quickly as possible. And one of those research labs is right here in Saskatchewan at Vito Intervac in Saskatoon. In fact, it's only one of very few labs in the world that has developed a vaccine candidate. And Dr. Volker Gertz, the director of Vito Intervac, recently said that early indications show that the vaccine induces an immune response, and they should know shortly if the vaccine is protective. So now they will still have a long way to go before they know whether the vaccine will be safe and effective. But it is very encouraging for all of us to know that our homegrown Vito Intervac is right at the forefront of the efforts to develop a vaccine, and they're doing so right here in our province. So thanks to everyone for the work that you are doing at Vito Intervac. I'll now turn it over to Dr. Shahab for his opening comments.
Thank you, Premier. So I just wanted to reconfirm, and we have the updated information on our website, that while the rest of the province remains fairly quiet in terms of very few, if any, new cases, and most of the cases are recovered, even in the far north now, while they have had a significant outbreak, they are now, almost 25% of their initial cases have fully recovered. So that's a very positive sign that they are now, by some indications, coming out at the other end in terms of recoveries happening, and we hope that that trend will continue. Many of their cases, as reported by the local medical health officer, they were contacts of previous cases, and they were successfully isolated at home or at alternate sites and had no further contacts to report. So I think that is the kind of interventions by public health, the intensive interventions, case contact tracing, testing, and supporting people to successfully isolate at home or at another site, that is essential to overcome an outbreak. Having said that, I do want to recognize that throughout Saskatchewan, as the rest of Saskatchewan reopens, as communities in the northwest of Saskatchewan come out of an outbreak, this is a marathon. And while over the summer we have learned a lot over the spring and summer about how to manage, and we really hope that as we reopen, we can maintain that discipline of physical distancing to keep our infection rate as low as possible. We need to be able to sustain that over the summer and then over the fall, and respond to events as they happen. If we do see a cluster or an outbreak, that has to be responded to in terms of the context in which it's happening, whether it's northern remote or another setting, a work site or another complex setting. So with that in mind, I think things are looking quite positive for Saskatchewan as well as for the Northwest, but we need to keep our vigilance up on especially for the North in terms of their unique context, but also for the rest of Saskatchewan as well. Thank you.
We now have about half an hour for questions. We'll take our first question from the phone line. Operator?
We have Roberta Bell with Global.
Hi, my question is for the Premier regarding whether there's been any progress or response to talks about resuming or reconvening the legislature in any way, shape, or form.
Yeah, there has been discussions with respect to how there could be some reconvening of legislative oversight. The House leaders, I think, had been discussing this for a number of days now. My understanding is they met last week, have intentions to meet again this week to discuss how the legislative oversight can occur, whether that's committees or legislative sittings, but how it can occur safely.
Follow up,
Will you
Roberta?
be responding to the letter from the opposition leader and potentially including him in these discussions and setting a date? Do you have a date yet?
I was actually quite surprised to see the letter come from the leader of the opposition today, as this is work that traditionally in this province, historically, has always been undertaken by the respective House leaders, where you have opposition House leader and a government House leader that will work together. And it's, I think, critical that work continue to happen at the House leader level to ensure that whatever we can come to given this time when we're also dealing with a provincial and a global pandemic, that it doesn't distract from that work and that it is done so safely. So we will be responding to the letter. But as I said, this is work that has already been occurring at the level that it historically occurs at. The meeting of the House leaders here starting last week officially, and my understanding is they also have a meeting scheduled for this week. And I'm sure the leader of the opposition is aware that work is going on. I would be surprised if he wasn't aware that work is going on. So I was quite surprised to see the leader of the opposition write a very public letter, asking for the resumption of full legislative services when this is work that is already occurring.
We'll take our next question from the room here. Steph?
Yeah, this is for Marlo Pritchard. There's been a letter, I believe it was addressed to Dr. Shahab, outlining some of the concerns that Northwestern leaders had about the checkpoints, confusion, clarity has been called for information and just how those checkpoints are working for. What is the public safety agency going to do to alleviate the concerns that have been expressed by leaders in Northwestern Saskatchewan?
Marlo, maybe I'll just at a very high level touch on that, and then you can likely fill in with some more detail what has been occurring as far as consultation and how we've been working with northern leaders, in particular throughout the Northwest. But Minister Carr, it's my understanding that she's had weekly calls with a number of Indigenous leaders, MLTC, PAGC, in the Northwest region, as well as weekly calls with all of the northern mayors. And my understanding as well through the Northwest Incident Command group that has been meeting with your Incident Command group daily, which would be this particular group, I believe it is, as well as daily calls with all of those affected northern communities throughout the Northwest has been occurring with the Public Safety Agency as well as representatives within the SHA. But you might want to fill in a few more of the blanks with respect to the structure and how that communication has been happening, Marlo. But I would just say that the decisions that have been made in the Northwest have in many ways been consulted on with leaders, across the Northwest and across the North and across the province for that matter. But with respect to the North, they have most certainly shaped the decisions that we've made that have impacted their communities. Marlo?
Thank you, Mr. Premier. Absolutely, as the Premier mentioned, SPSA is in consultation with a number of different groups in the Northwest. We recognize that there are challenges and issues that have been raised with us. We are, looking at each one individually and try to address them as they come out. Some of them are in regards to interpretation of the public health order, and we work with them. I reach out to the local communities. We will be responding to any letters or concerns that are raised, and we continually work, with the communities and our partners to ensure that the public health order is enforced for everybody's well-being, and make sure that the communication, and I think that's probably the key, is the communication is why that activity or travel is not allowed at this point in time. So we continue to work with those communities, and we will continue as we move forward.
Follow-up, Steph?
Yeah, Marlo, there's been some concerns raised that people have been prevented from getting essential items like groceries or been stopped from going to, say, authorized appointments. Have any conservation officers or provincial employees that are manning these checkpoints prevented people in the far north from going to get groceries or partaking in some kind of authorized travel?
I've had some of those same concerns raised with me. Again, the way the order is worded is it's to get essential services or groceries at a location closest to their home address. So often it is where they want to, or at least the information that I'm getting is where they want to go farther than the local community, and so they're being encouraged to go to that community or back. So, but each one of those we are following up on, and we work try to make sure that there's understanding.
I would just add to that, Marlo, that's exactly right with respect to just the reason the health order is in place is to limit travel. That's how we limit the spread of this virus, is by limiting our travel within our community, limiting our travel between our communities. So the checkpoints are there for that specific reason. That being said, and Marlo had mentioned, there have been some individual concerns raised of people that have come through the checkpoints and feel they should have been able to go through for one reason or another, and we follow up on each of those individually. But there is essential reasons why people would need to leave their community, but those checkpoints are there to limit the spread of this virus, and they're there for a reason.
We'll take our next question from the phone line, operator.
We have Mark Smith with CTV.
Hi. What is the process for determining if someone has recovered from COVID-19? Are they retested again? And what's been the average time it's taken for someone to recover in the province?
So currently for individuals who have mild symptoms and are well enough to self-isolate at home or in the community, public health follows up with them, and after 2 weeks since the onset of symptoms, if symptoms have settled down for more than 48 hours, then they are cleared to and no longer considered infectious. Repeat testing is no longer required in the majority of cases. Of course, for the few cases who require hospitalization, additional considerations may apply, including repeating testing. But there also, generally, the period of hospitalization may vary, and recovery may take a longer period of time. But that's not just in terms of recovery from clearing the virus, but recovery if there's other underlying comorbidities that required hospitalization in the first place.
Follow-up, Mark?
Yes. What's Saskatchewan's current reproductive number, and at what point would the province reevaluate the reopen plan? How high would that number need to get?
So we did request the modeling team to look at the RT, the reproductive number as a whole, but also for an area of the province with an outbreak, and also for the rest of the province. So based on some preliminary data that I received on Friday, while the RT had gone down to around 0.74 and was edging up close to 1 over the last week or two, it was primarily being pulled up due to the outbreak in the Northwest. And when they looked at the RT for the rest of the province, it remains in that around 0.74 range, and that is obvious if you look at the new cases in the rest of the province, that it's very low. But obviously it is higher in the La Loche area, around 2, which is very similar to where it was in the rest of the province early on in around March. But obviously, we are obviously watching both the case numbers and the RT very closely provincially, but also in specific parts of the province with an outbreak, which currently is in the Northwest in terms of the impact it has in terms of the modeling side. But currently, as long as outbreaks remain confined to a specific geographical area and are managed, which in this case are extensive public health interventions, including testing, active case finding. The hope is that as outbreaks settle down, that will pull the provincial reproductive number lower as well. And I just want to also restate that we've discussed in the past also that if we see cases popping up all over the province without any known link to a known case, that would be a very different thing if that is pulling up the reproductive number to 1 or higher than a localized outbreak, which of course is very concerning for that part of the province and has to be managed very actively like it is being in a loss. But that is a very different situation than if it was happening throughout the province. Thank you.
We'll take our next question from the phone line.
We have Murray Mandrick with the Leader Post.
Good afternoon, sir. Further to the question on reopening the ledge, is it your intent still to present a full budget? If so, what kind of adjustments do you have to make because of the time frame involved in terms of passage of the budget, which usually entails several days sitting? And what instructions have you given to your House Leader about if you want to pass the budget, what negotiations or what compromises you're willing to make sure it's done efficiently and expediently?
Well, we're operating right now on our special warrants as per our agreement when we dissolved the legislature. The conversations with the opposition, I believe they met last week, very preliminary with respect to what this may look like to enable some degree of legislative oversight, if you will. With respect to the budget, this is why it was so very important for us to table the estimates at this spring sitting. Those are the estimates that our special warrants are based on. So the investment that we are making each month is based on the estimates that were tabled in the House. I will leave, so that is the bulk of what a budget would ultimately be. The revenue forecast would make up the other side of that budget, of which we have the other parameter or variable, if you will, in that budget, of which the Minister of Finance has provided one update already. I imagine we'll be providing further updates as we go through the next number of weeks and potentially months on what the revenue forecast for the province is looking like. And this is all done in an effort to conduct ourselves in the most transparent manner possible. So whether or not we will be introducing a budget or at what point in time that may be, or I guess more so the spending estimates have been introduced, would be on passage of that budget, would be up to a negotiation that would occur between our House leaders. I've given no specific parameters as to when or should that occur in the very near future. We, first and foremost, wherever we are able, and I've never precluded the opportunity that we should reopen in some way, shape, or fashion the legislative oversight. But it cannot distract from the effort that we are making as a government and as an entire public service on addressing this pandemic that is in front of us.
Follow up, Murray?
Well, it is your call as to whether or not you present a budget or go to the polls or do whatever. So I guess what I'm asking is it your desire to have a budget presented and passed before we go to the polls in October, or are you quite comfortable going to an election having governed on special warrants?
Well, we have presented the investment estimates on behalf of the people of the province. They are tabled in the legislature, and so essentially that is presented prior to us going to the polls on October the 26th.
We'll take our next question from the phone line, operator.
We have Lisa Schick with CJME.
Do we have you on the line, Lisa?
Oh, yeah, I didn't hear the introduction, sorry. We've been told that there's at least one person being taken from the far north or north and brought down to Regina to be able to self-isolate. I'm not sure who would be best to speak on this, but just wondering what you can tell us about that, how often that's being done across the province, and what kind of safety precautions are being taken in those cases.
Marlo or Scott, would you have anything to add to that?
Only that I'm not aware of that specific case, but as we've created the plan for COVID surge and dealing with COVID positive patients, the capacity that we built province-wide is there for all residents of this province. So although I don't know the number of patients that we've had to move, particularly just in hospital patients, we would have the capacity that, so it's likely that occurred, but I'm not specific to that case.
You have a follow-up, Lisa?
Yes, so would that only be done in the case of somebody who needs care, like if they did need to go to a hospital, be taken to a different hospital in the province, or would that be done in cases where somebody just needed somewhere to self-isolate?
Marlo, you might follow up on this, but if someone needs a place to self-isolate, we have provided our Sask housing units, our education housing units in Alash for that purpose, as well as we've moved, I'm just unsure of the number, but in excess of 10 mobile units into the community as well for individuals to self-isolate in. So if they do need a place to self-isolate, that has been provided through the collaboration and guidance from the leadership in the community of Lalash.
So the only thing I would add, Premier, is that if we had and we have had, patients in the province who are COVID positive but have other healthcare needs that require services that are location specific, for example, in Saskatoon or Regina, and only available there, we would have those patients relocate and potentially would have them opt in, for example, a hotel while they were receiving care. So they would be appropriately moved, not because they're COVID positive, but because they have other healthcare needs.
We'll take our next question from the room here, Steph.
Yeah, to the Premier, you mentioned that Lloydminster will be participating in Phase 2. What has been the decision about Lalash and whether they will be going ahead with Phase 2?
We haven't made that decision yet, so the status quo.
Okay. And further to Murray's question, I mean, do you intend to present revenue forecasts and a deficit for this fiscal year before you head to the polls in what is planned to be October?
Yeah, we already have. We have, not in the legislature, but we have communicated with the public where our best assumptions of the revenue forecasts are. The Minister of Finance did that I'm going to guess 3 weeks ago, and we'll be looking to do that again as those forecasts clarify in the days ahead.
We'll take our next question from the phone line, operator.
We have Ashley Martin with the Leader Post.
Hi. So we've seen quite a few large events canceled so far. The Regina Folk Festival, the Saskatoon Exhibition today, and Western Development Museum's events. I've got kind of a few questions tied into one, because there are a couple of large events that have yet to announce a change in plans, including Country Thunder in Craven, the Queen City Exhibition in Regina. Could those events go ahead in some capacity this summer, given gathering bans and all the precautions? What would the government's plans be? Would you fine those organizations for trying to go ahead? Would you mandate a cancellation, tell these organizations that they cannot go ahead? Like, what is the process if it comes to the end of June and Country Thunder still hasn't announced that they will not be going ahead on July 9th, and Setup goes ahead? And just to use Country Thunder as an example, there are lots of other large festivals going on.
Right, and there has been a number of events that have canceled due to the time that they need to either go ahead with their event or to actually cancel performers and cancel all of the preparations that need to occur. That time frame of preparation, if you will, is different for each and every event that is out there. So with respect to if an event like Country Thunder, wanted to occur today, it wouldn't be able to under the public health orders that we have with gatherings of 10 people and trying to keep those gatherings into 1, maybe 2, possibly 3 households. So it just wouldn't be able to be held here today. If those public gathering sizes would, expand to, I don't know how many people would be at that particular event, but at many thousands between now and July, then I suppose that event would be able to go ahead. Doesn't appear that will be the case for many events this summer, unfortunately, including and up to and potentially including even this fall's Grey Cup, which I don't know if they've made a decision on that yet or not. But the fact of the matter is that the organizers of these events, they make their own decisions and as to when that event will go ahead. But the parameters as to what needs to happen for an event like that to go ahead in the way of public health orders are made by the gentleman sitting to the left of me, and those public health orders wouldn't allow events like that right now and quite likely won't for the foreseeable future.
You have a follow-up, Ashley?
Yes. So just to clarify, knowing what all the phases are, it's very unlikely that a large event could happen even into the fall or winter, as you just said with Grey Cup. So what would happen if the organizers of such an event decided, yeah, we want to go ahead and we're going to set up our stage and we're going to set up our food booths and everything, and would the government send police or somebody to shut that down, or how would you go ahead about stopping if an organizer decided to go ahead, hypothetically?
Yeah, at the risk of answering a hypothetical question, which I promised myself I would never do, I will answer a hypothetical question. The conversations, in particular with Country Thunder, the organizing team there that has put on a really good festival here in our community and in our province for many years, and as well in other provinces, as well as a vast number of other events, are all in consultation and far before they would start setting up structures and blatantly looking to operate outside of what the public health orders are here in the province. So I wouldn't expect anything like that to occur from any of the organizers that I know of that have held festivals such as Country Thunder, such as the Grey Cup, you name it. So I don't think that will actually be the case. However, in saying that, each of these distinct organizations are their own organization, and it is on them as to whether as to how long they have to organize to set up for their particular event. And if they don't want to actually officially cancel that event until the very last opportunity that they have, that's their prerogative, and we respect that. And we will work with all of the event coordinators if they have other suggestions, for example, on how not that specific event, but other events may be conducted in some virtual way or anything that may be in compliance with the public health orders for people to enjoy. And we see local music talent taking to the online, not really the airwaves anymore. I guess it would be to the fiber optics in getting their music out. And we'd encourage people to get out, get online, and support some of the great music and even maybe some of the virtual festivals that we have access to.
We'll take our last question from the phone line, operator.
We have Allison Sandstrom with PA Now.
Hi, I'm just wondering, when would the province consider relaxing some parts of restrictions about the Northern Administrative Zone? What would have to happen for some of those restrictions and roadblocks to lift?
So I think, so initially, I think some of the restrictions were put in place because I think there was concern, especially with the initial cases in the north, about just calming things down to make sure that so that the northern leadership understands the dynamics in the north, the transmission dynamics. We're able to get over the current clusters or outbreaks that are already happening. Once that's settled down, and I think northern leaders have learned a lot about what works in certain settings when there's an outbreak, and what some of the challenges are, as well as the fact that there have been many cases in the north where individuals, just like everywhere else in Saskatchewan, have successfully isolated at home, have recovered, and there has been no further transmission. So once there's a better understanding of all these factors, then from my perspective, I think once the northern leadership feels that they are able to then cautiously relax some of those restrictions over the summer, I think that would be a sign of, cautiously relaxing some of those restrictions. But I also want to say, and this is not just for the north, but it's related to reopening in other jurisdictions, that I think we still have to very cautiously learn as we move forward in a new normal how we can reopen and still keep case numbers low. Because on the one hand, we all see in the south, we all see now more traffic on the roads. There's evidence of more social mixing as virtual households are allowed in communities with no outbreaks. But as long as that happens with as much physical distancing as can be maintained while we are out and about, that will keep our numbers low. And as social mixing goes up, we have already seen from other jurisdictions, primarily in Europe, for example, in Germany, that case numbers do start to rise. And I think that's the fine balance, that how do you open up, allow more activities in a safe manner as much as possible, but understand that once that happens, we still have to maintain as much as we can that physical distancing, not going out when you have any symptoms, to maintain our case numbers as low as possible. So I think some of those learnings would be applied to the north, but they are also very relevant to everywhere in Saskatchewan.
Do you have a follow-up, Allison?
Yeah, so obviously the area right now is very large. Is there any discussion to, dividing it up in some ways, that areas in the northeast or central would be able to open before the northwest?
So I think what I've heard from northern leadership and my medical health officer colleagues who meet regularly with leadership in the north is that there are interdependencies in terms of corridors where there's traffic and there's needs that are fulfilled, if not in one community, then down the road in terms of shopping and other essential services. So I think some of these things happen because of naturally defined geographies where there's interdependencies. So some of these steps have to be taken not necessarily community by community, but as geographies that have those interdependencies built in.
I believe we have one last question on the phone line, operator.
We have Kendall Latimer with CBC.
Hi, this question is for the Premier. We're hearing a lot about healthcare workers heading up to the north to provide supports and the new alcohol management program, but at the same time, we're also hearing locals and professionals saying that there are not and have not historically been enough permanent healthcare supports in that area. Has this outbreak highlighted existing gaps in mental health supports or healthcare services in La Loche?
I've been on the ground in La Loche on this topic as well as others just a few years ago when we had a different challenge in that community. In my capacity at the time as advanced education minister, and we had a lot of discussions around some of the needs of the community, not only with respect to mental health and supports, not only for students and families, but also for professionals that were working in the community of La Loche, as well as we had discussions around healthcare supports in the community as well, and who is providing those healthcare supports, whether we need to attract professionals in from other areas, or can we train some of our healthcare providers, in that community, or some of our educators, for that matter, in that community, of which we are doing jointly now with Clearwater, as well as the community of La Loche and the First Nations University here in Saskatchewan. So there are needs that are required in La Loche. We've been working with that community on those needs for some time. And we'll continue to work with them on the longer-term needs that the people in that community do require, as we have been. But this pandemic, I think, presents a number of other more immediate needs that we need to provide to the community and provide in very short order, and we're doing that through very close work with the local leadership in that particular area, in the La Loche and surrounding community area, as well as a broader leadership group throughout the entire Northwest, and ultimately all of the leaders across the North.
Follow-up, Kendall?
Yes. What healthcare resources and services, if any, will be kept in La Loche once this outbreak is over?
In general?
Speaking to mental health or healthcare, will any of the services or resources that have gone to the community, like the alcohol treatment program, be kept there once this is over?
I'll have to, that would be a question best posed maybe for Scott or for the minister with respect to that program in particular. There is some programs that are being provided because of some of the decisions that we have made around the opening of access to liquor in the community through very close consultation with the community of La Loche as well as the surrounding communities. But there is no doubt there's an ongoing conversation, not just with the community of La Loche, not even just with Saskatchewan's North, but with communities right across this province on our mental health and addictions and our commitment to not only funding but funding towards outcomes when it comes to mental health and addiction supports here in Saskatchewan. There's been unprecedented investment in this area, not only in Saskatchewan but across Canada over the course of the last couple of years. And I think you can expect that unprecedented investment is going to continue into the future, as this is a challenge that cuts across all sectors of our communities. It's not exclusive to the North, but it is a challenge for northern communities as well.
Do we have a comment from the SHA on the line there?
Yeah, it's Scott, just to add a little bit to the Premier's, we are not done with COVID, as you've heard both the Premier and Dr. Shahab say many, many times. We will not be returning to business as usual, as we both open the economy and the healthcare system. So with respect to the resources that have been put up into La Loche that are not new resources, I mean, many of those things, including supports for self-isolation, managed alcohol program, will be required up there, not just now during COVID, but in particular getting us through the summer. We have actually expanded some services in La Loche and other areas of the North throughout our COVID pandemic. It's one of the learnings, and one of those things in particular has been our ability to do testing locally for COVID, as well as that equipment can be used for other healthcare needs for the community, so that's staying in place as well. And then last but not least, although we may see some of our contact tracing and supports pull out a little bit as we get the outbreak under control, those folks are ready and able to come back in at any time where we see another incident or outbreak pop up across the province. So, and then last but not least, I would say, last week we announced the Government of Saskatchewan Suicide Prevention Plan, which applies to all communities across this province, not just southern communities, but also communities across the North, where we see need for both mental health addictions and suicide supports long term.
That concludes our time for today. Thanks very much for joining us.